And we're back. JaLynn, welcome back.
Thank you.
Listen, it is so great. Every time we have you on, we get great feedback,
Thank you.
Madison House interest, but still not enough people know as much as they need to about Madison House. So maybe if you could tell us more about it.
Good.
Even though for me, it's, I feel like I should be
know
there.
all
but
about it.
Yes.
Well, Madison House Autism Foundation was put together because we have a son who is on the autism spectrum. And my husband and I did some market research and found out that adults on the autism spectrum were not being served adequately. So we stepped forward over 8 years ago in putting together a foundation, and we wanted to do it nationally, and it's located here in Montgomery County. And we're working with all sorts of issues that individually are very difficult to deal with. And so we're trying to bring people together, organizations, schools, universities, parents, to solve some of the problems that lie ahead. The population of being 21
Right.
and over on the autism spectrum, very often this is an invisible population because people have the feeling that, wonderful, let's have treatment for the little kids, and then you don't hear a whole lot. People graduate, and I think a lot of people assume that autism is taken care of by
We have
them.
a similar issue with developmentally disabled individuals.
Yes.
Same
Same
thing
thing.
that you're off after that 21. And so tell us about some of the things that you're doing and successes you're finding.
We're working with trying to increase definitions for accommodations for housing. So there's a multiplicity of options out there because we don't have enough housing. And one of the big questions is, what's going to happen to my adult child when I'm no longer around?
Right.
And then there are individuals wondering what's going to happen to them because they may not have family support around, and we're trying to help solve those problems. We're advocating on a national level when there can be appropriate legislation. We work behind the scenes with the ABLE Act in making certain that some things
Okay.
we're moving forward with that. We're working with connecting universities, so where it's appropriate for those on the spectrum to attend universities, that they can do so.
Well, think about universities and all that stuff. Let's think about that phone number. If people want to learn more.
If they
need
want to
call.
learn more, I would suggest them going onto our website, which
Okay.
is madisonhouseautism.org.
Okay.
And that has a lot more information right there.
Perfect.
So, question about the housing. Is
Yes.
I'm assuming it's not everybody on the autism spectrum. You're talking about
No.
the special needs of those who are on the more severely impacted end of it?
It's a very, very big umbrella
Yeah, that's
that
what-
embraces autism.
Right.
And a lot of individuals will be very independent and living on their own. And it includes Asperger's as part of this spectrum. The thing is, even those with Asperger's are facing unemployment. There's about a 15 to 20% employment rate, not unemployment, but an
Wow.
employment rate. And so the
Just in Asperger's or across the
across
autism
the
spectrum?
spectrum. And heavily into the Asperger's area as well. So that means that housing dollars are limited because they don't have the type of income, and they may not always qualify for Social Security and other types of things too. So there's a number of issues
That you're working,
covering
okay.
the whole broad range. And there's some individuals who are very high support needs, and then there are very independent individuals, and then a lot in between. So, very good observation.
What successes that you're seeing? I mean, what's something right now? I mean, we talked a little bit as you're going through the different programs. What are you most proud of at this moment?
The thing that I'm happiest about is that there's a national conversation starting about adults on the spectrum. We were one of the only autism organizations working with the issues of adults when we started. Now there are more and more organizations. There aren't that many on the national basis, but they're working in their own communities.
So you're able to a network around, expand that network.
And we want to kind of connect the dots. So if there's something good happening in Indiana, we can connect it with
Lessons
Baltimore.
So, JaLynn, it sounds mostly as if you're affecting policy. Are you actually also a place where folks can live? Madison House sounds like
It
it's
sounds
a
Madison
shelter.
House. We do
About
have
15 seconds.
the housing component to it, and we will be making an announcement a little bit later this year on some issues. But one of our major initiatives happens to be with the lady sitting next to
And we'll
me.
go to her next. And so I'm hoping you're going to have that major announcement right here on Montgomery Week in Review.
You've got my word on it.
Yeah, Carla Satensky, our producer, will be very happy. She likes when news is made here. JaLynn, thank you so much.
Thank you for hosting.
And a great
things.
segue then come in, and you've got that. It's Faith Frankel.
Yes.
Welcome. Your first time on the show.
Yes, thank you.
So tell us what you're doing and with Madison House and to help the objectives, help further
Absolutely.
the objectives.
So one of our medical initiatives that I'm very proud and excited to be a part of is teaching physicians how to give the care they've been used to giving, whether it's for 5 years or 50 years as a physician, to patients on the spectrum. Because you can't take the approach you're used to and have it work most of the time.
Let's talk about some of those things. What's different about treating an individual with autism?
First of all, and especially with adults on the spectrum, some of the behaviors that you would see in a pediatric patient, tantruming, not wanting to wait in a waiting room, not wanting to be touched or examined, haven't extinguished. So you could have a 25-year-old who doesn't want your stethoscope on their chest and might start screaming and flailing and hitting you.
Okay.
You also have the challenge of communication. Autism brings with it challenges with socialization, communication, and repetitive behavior. So many times we're used to joking around with you to put you at ease. That might fly right over the head of someone on the spectrum, and they might not want to hear all of our talking. They might just want to hear some very simple yes/no questions rather than elaborate explanations.
So doctors have been receptive to this?
Very receptive. One of the things I'm extremely excited about and was proud to do was return to my alma mater where I trained at Georgetown and actually give this lecture to all the physicians in the audience who trained me. And many came up afterwards and said to me, I wish I had that lecture a long, long time ago in medical school, which is one of the things we are trying to advance. We're not being taught in medical school how to do this. There is no formal instruction. It's something we're learning as we go. And that's not something you want your doctor to do. Learn something as they go and do it to you.
Do you see a number of doctors who get it and understand how to address the special needs of those with autism, and so they're now becoming the go-to doctors?
Yes,
for
once
individuals?
word gets out that you know how to put your stethoscope on a child or talk to them or maybe offer them the first morning appointment so that they don't have to wait in the waiting room, the floodgates come in, right? Everybody knows. They know how to talk to me. They know how to examine my child, or just me as an adult. They know that it might take me a while to answer your questions, and I might want to rock back and forth a little before I answer that. And yes, as soon as that word gets out there, they're going to come to you.
And we're finding something too, that very often autistic adults are remaining with their pediatricians up and into their 40s. Now, when it comes to gallbladder and different types of things, most pediatricians are not prepared to handle that type
Most
of thing.
doctors can't do that, but surgeons. So what is the pediatrician then carries?
So what we're
patients
trying
through?
to do, and we don't want to let them go, right? But we're sort of torn between, I know I can examine you, but I really don't know about hypertension and diabetes and things like this in an adult. So we know we need to let them go at some point. And that's part of the initiative, is that we want to get out there and educate our internal medicine colleagues on what's coming their way. I call it the medical autism tsunami of adults that are going to be coming into their doors, and they might recognize that this patient's having some anxiety or is a little quirky, but they really aren't going to get how to care for them. So we want to do this on many levels. Med schools, we give grand rounds like I did at Georgetown. I've gone to Suburban Hospital and giving lectures to the operating room staff.
Our video that will be
the
on
video
our,
we've just made
on our
to get out
website.
there. So we're sort of trying to blow it out in all venues as fast as we can. And the doctors are aching for it. They really, really want it. They're very receptive.
That sounds pretty exciting.
And it will be available on our website for parents and for physicians, because it's often helpful for parents to know how to go to a physician's appointment with their child, adult
And what
or
to ask
otherwise.
That's a
for.
huge part of our initiative, is that when I give this lecture, I've often given it with doctors and parents in the same room, and I will tell the parents things they can do. First and foremost, tell us how to examine your child. Tell us how to talk to your child. If you are an adult on the spectrum, tell us how you want to be examined. We want to unleash that communication because you need to help us.
What a difference, though, in the whole mindset of doctors. Because
Huge.
very few doctors believe that patients have much to say about that.
Well,
and the
it's
traditional bringing up, I
oh,
mean, to have this-
absolutely. And that's
you know.
something that we talk about is that there's this hesitancy sometimes with patients because we're the expert in the room, right? But I've often said to physicians, you have an expert in the room to help you out. Physicians aren't, it's not hard to turn them around to this thinking at all, because when we're uncomfortable and we don't know how to do something, we help each other. That's what we're used to doing. And they're very, very receptive to say, autism's coming, what do I do?
We've got a little bit over 30 seconds left. Give me a breakthrough moment for you in this work.
Breakthrough moment for me as far as my learning curve when this happened.
Sure.
I was examining a child that I did not know was on the spectrum. Parents didn't know the child was on the spectrum, and this child was extremely intelligent. So I was engaging the child that way. And when I took my stethoscope out, I watched my entire visit go down the tubes. I could not get one heart sound from that child, and it was an aha moment that just that brief adjustment I could have made a difference.
I want to thank you. You've given us a lot of aha moments today as well. All of you have. This is a great aha show. As a matter of fact. And I want to thank you for being here with me today. And I want to thank all of you in the viewing audience for being here with us for this week's edition of Montgomery Week in Review. I'm Don Moores, inviting you to join us next week at this very same time.
Yeah.